and welcome to the Art of Being Human. We're studying medications. I'm not giving you specifically what medications are used for what conditions, but I just want you to know how they're tested, how they come to market, how do they know that a drug is safe, and if a drug is not safe, they have to weigh the benefits against the risks of all drugs. And I just want to review the fact that most drugs have 3 names, and then I'll go on from there. This is about where we stopped on the last segment. The drugs have 3 names. They have a medical name, and it is a council that consists of pharmacists and physicians that give it the medical name. And that's one name. And the second name they have is a brand name that's given to them by the manufacturer, the people who produce the drug. And it'll be a name that'll be easy to remember so that you'll be familiar with it. If you're familiar with it, you're more apt to want to buy it. So therefore, it's for the convenience of for easy memory. And then they have the clinical name, the chemical name, where the drug is discussed. Its characteristics are described in the chemical name, which is usually a long name that no one's going to remember anyway. So you have those 3 names, and then all the drugs are scheduled. Whether a drug is going to market or whether it's going to be too dangerous or not effective, so they keep it off the market, it still has to be scheduled. And you will notice on your prescription bottle that it will say you can refill it 3 times in the next 6 months or something like that. And so that's according to the schedule that it has. And the schedule that it has is dependent upon how easy it is to become addicted to it. If it's really easy to become addicted to it, you can't refill it, because it would just be too easy to become addicted. And then as the schedules go along, the latter schedules, there's no problem in terms of addiction, because you probably would never get addicted to it, or you probably wouldn't take enough of it to ever get addicted to it. And those can be sold over the counter because they're not fearful of what's going to happen to you. So let me review these schedules. I didn't really get into this last time. Schedule 1. These are the drugs that are illegal because there's a very high potential for abuse, and so it's illegal to have them. And they usually do not have any kind of a medical use anyway, so they're not ever going to be on the market. But the fact is they are a drug, and they do have to have a schedule attached to them. So Schedule 1, illegal, high potential for abuse, no real medical use. They are not for sale. You cannot buy them. That's Schedule 1. Schedule 2, there's a high abuse potential, very high potential for abuse that can lead to dependence. So they do have a medical use, so they can be prescribed, but they can't be renewed. And so you can only have a certain amount, and then they're not renewable. That's Schedule 2, because of the abuse potential. Schedule 3, they have a lower potential for abuse, but they can cause some dependence. So these usually can be refilled 5 times in 6 months, as long as a doctor orders it. If the doctor feels that this medication is needed, he can, on a Schedule 3, have it refilled 5 times in 6 months. But that's it, no more than that, and only if the doctor orders it. Schedule 4, and there's a lower potential for abuse than in Schedules 1 through 3, so they can be filled, and they can be refilled 5 times in 6 months if the doctor orders it. So it has to be by doctor's order, but there's still some potential for abuse, but not as much as Schedule 1 through 3, which is the worst ones for potential for abuse. Now, Schedule 5, there's a very low potential for abuse, as usually it involves small amounts of narcotics that you can get them over the counter. You don't have to get a prescription for them. Things like cough syrup and things like that might have a small amount of narcotic in it, but not enough so you would typically get addicted to it. So that would be Schedule 5. Now, so those 5 schedules, and when you look at your prescription bottle and it tells you how many times you can get it refilled, or if you can't get it refilled, it's according to what those schedules are, because all of the drugs have a schedule attached to them. Now, drugs act differently in your body. Sometimes their workings are not really fully understood, and sometimes they work better on some people than they do other people. Some people develop allergies, some people can't tolerate things with the drugs, and so they have to be aware of the fact that different people are going to react different ways. It's one of the reasons why they do so much testing on the drugs before they decide that they're safe for market. So what are the categories? There are 3 categories of drugs and what they do in your system. So I'm going to go over the categories of drugs. One category is that the drug replaces something that you don't have that you need. I keep thinking about menopause, when women don't have estrogen in their system or it's greatly reduced. So what do some of them do? They take estrogen shots. It replaces the estrogen that they are lacking. And if they're having very severe symptoms of menopause, and some women have totally awful symptoms, it will stop the symptoms because it's replacing what your body doesn't have. Now, the pituitary gland has something to do with this, because the pituitary gland sends out a follicle-stimulating hormone, and it's really asking the ovaries to produce estrogen, to produce an egg. And if for some reason the ovary can't do it, that FSH, follicle-stimulating hormone, gets in the system, and it builds up and it builds up because the pituitary gland is sending it out but not getting a response from the ovary, so it keeps on doing it. And so all of that extra FSH in the system gives you very severe menopause symptoms. Now, not everyone has all of these symptoms, but some people do. Some people have terrible symptoms, and so they really need to have estrogen in their system to stop the symptoms, because the pituitary will stop sending the FSH if it gets a response. If the ovary can't do it, then you can inject something or take medication that gets into the bloodstream and does it for you. Now, I understand that Premarin, that was one of the pills greatly used and probably still is used, I don't know, for menopause symptoms, actually came from the urine of a mare. So you still have some animal sources, although I think maybe now it's more likely that it's been perfected in a lab so that they can chemically reproduce a drug that used to come from herbal sources but has the same effect as the herbs without using the herbs or without using the substances that come from animal sources. So that first category, it replaces what you are deficient in. If you don't have enough vitamin B, maybe you're taking medication that gives it to you. Whatever it is, it replaces what you lack. Then there is a type of drug that interferes with the functions or the transmission of impulses that come from one part of the body to another. Supposing that you are having a lot of pain, well, a medication may stop it. It may interfere with those pain impulses so that you don't have them anymore, and so therefore it's a good pain reliever. And as anything, it stops whatever's going on in the system that causes the system to make you uncomfortable, to make you sick, or cause other symptoms that you don't want to have. So that's another one, another function of medication. And the third one is that it acts against an organism. In other words, it can act against a disease process, stop a disease process, stop infection. You know, it actually stops something that's going on now, and I would think that antibiotics would do that, or other kinds of medications to stop something that's going on in your system. So once again, to replace something that you need, that you're not getting, to interfere with the cell function so that you're more comfortable, or to act against an invading organism that's giving you an infection or abnormal cells, something like that. So those are the three categories of things that happen. Now, drugs have different effects on the body. Not everybody reacts to them in the same way. Yeah, some drugs act quickly, and a doctor has to be mindful of how long it takes for a drug to get into your system. It may be rapid. You may have a rapid effect, and some drugs have side effects. You need to be mindful of what the side effects are. Some doctors will tell you, if you buy the medication, it'll list what the side effects are. I know that in one medication, deafness is a side effect. Do you know that in some medications, C. diff is listed as a side effect of the medication, especially if you're taking antibiotics? And C. diff, I never used to know what it was, but it's a very, very bad intestinal problem in which you have an intense amount of diarrhea. It's hard to get rid of. It happens all the time. You have no control of it. They can give you medication for it. Sometimes you have to be hospitalized. There are some antibiotics where C. diff is listed as a side effect, but there are some antibiotics where it's not so likely that you'll get it. It's a very bad thing, and there are a few thousand people that die every year from C. diff. There is a way of healing it, but they only use this a particular way of healing it. It works in 96% of the cases, but I don't want to mention what it is. It's a little gross. But at the same time, they use everything else that they can first before they resort to this last thing. Now, drugs will interact with each other. They may cancel each other out. They may make each other stronger. And you need to know, if you're taking something, what does it react? What else are you taking? Is it going to react? Is it going to stop it from working? Is it going to make it too strong and make you sick? It's really quite an art. If you consider all of the medications that are out there, you can get big, thick books filled with medications and what they do. And a pharmacist has to know all this, because they have to know what medications react with what medications and who can take them and who can't take them, which means they like to have you have all of your medications from the same pharmacy. And it's not because they're trying to hide anything or they're trying to get too much information, but if they know what you're already taking and a doctor calls in a medication that may not be good because of other medications that you're taking and the interactions between those medications, a lot of times a pharmacist can tap into something that a doctor himself might miss. So it is important, if you can, to get all your medications from one source. And sometimes you can and sometimes you can't. So drugs interact with each other. They combine with each other. They form compounds, and sometimes those compounds that they form, because in their drug interactions, they cannot be absorbed in the body easily. So a doctor has to be very mindful of what you're already taking. Now, usually when you go to a doctor, they'll ask you for a list of medications. If you go in for surgery, they'll ask you to bring your medications with you. It's not to take them away from you. It's so they have an accurate list of what you're taking and how you're taking it and when you're taking it, because some medications can't be taken at the same time as other medications. There has to be a space of 6 hours or so they don't interact with each other. You know, even if you're taking something like a diet thing, supposing you're taking a smoothie. I remember about a smoothie, and they advertised that if you had a smoothie and there was a powder and you mixed it with milk or something, or water, whatever, and you could get like your daily requirement of calcium in that one smoothie. Now, a daily requirement of calcium might be 1,200 to 1,500 milligrams. I mean, it's really quite a bit. It's over a gram. And this advertiser said all you have to do is you drink this smoothie in the morning and you have all your needs for calcium for the entire day. That would be like about 1,200 milligrams of the calcium. But then what if your body only accepts about 400 milligrams? Maybe your body can't absorb that much at a time. Maybe it can only absorb 400 milligrams. Then all of the other milligrams you have that you've taken in that drink are for naught. They'll just get flushed out of the system. You know, vitamin C, people use it to help with infections, and they use it to help with colds and this kind of thing. And sometimes they take a lot of it. But, you know, vitamin C will get flushed out of the system, so that if you are actually taking too much, the body will use what it needs to use and the rest of it goes out of the system. Well, with calcium, it'll take what it can, the rest goes out of the system. So it's better to take a smaller amount, and I'm referring to calcium. It's better to take a smaller amount and make sure you're getting it, and take it at 2 or 3 times during the day so you actually get the full amount, than to take the full amount and lose half of it because it gets flushed out of the system. Now, I need to, I guess, review and find out how much the body can absorb of calcium at a time, but I remember reading that it can't absorb 1,200 units at a time, so it's best to have it broken up during the day. So you have to be aware, even of something like that, if you're taking it. Now, when a drug, most drugs have to be absorbed by the bloodstream to do you any good, but not all of them. Some drugs do not have to go into the bloodstream, but they need to get to the site where they're needed, the place where they're needed, although many of them need to go into the bloodstream. So when a drug needs to go into the bloodstream, then this is how it's given. It can be given by mouth. It's going to eventually get into the bloodstream through absorption. It can be done in the rectum, an injection to inhale, or injection under the skin if you want a slow release. Now, for injections, some injections just go into the skin a little bit, underneath the skin, and that gives you a slow release. Some go into the muscle, intramuscular injections, and some get injected right into the bloodstream. So there are different ways, even in injections, of getting it to the place where it's supposed to be at the time it's supposed to be there. So mouth, rectum, injection, inhalation are injected under the skin for a slow release time. And it is desirable to have it reach the blood system. And some, of course, medications are used topically, and they are put on the skin and they absorb. Now, here are the different drug forms that people take. There are different forms of the drug for convenience, the ease of taking them, for the proper dosages to make sure that the dosage is accurate. You can take your medications in tablets, capsules, liquids, some kind of a mixture, an elixir, an emulsion, and syrup. So let me just go over those. The tablets, of course, are solid dosage forms, and you swallow them. The capsules are gelatin. They like a gelatin kind of thing. It's easier to swallow it. It has like a gelatin shell, and you swallow, and the drug gets released after you swallow it. Then the liquids, which are basically a mixture of a drug in a solution, so it makes it easy to take. You just swallow it. An elixir is a solution with a flavoring to it. It may have a sugar base or an alcohol base, and so you would take it, but it is kind of a liquid, but it has flavoring and it has sweetener in it. An emulsion is a drug that's suspended in oil and water. That's an emulsion. A syrup is a solution that contains the drug and sugar. So cough syrups and things like that. Then you have your skin preparations, creams, ointments, and lotions. The creams are non-greasy and they will absorb. Ointments are greasy and they don't absorb, so you're forever, it's on your skin, it gets wherever, unless you bandage it or something, it gets everywhere. And the lotions are for unbroken skin to cool and dry the area, so creams, ointments, and lotions. And then you also have suppositories and what you put in your eye drops, ear drops, nasal sprays, inhalers where the drug is actually under some kind of pressure, and you press a button and it goes in your nasal passages as you're breathing it. So you have to be careful of drugs because of different things that happen according to the ages of people. You have to be careful. Children and adults do not react to medications in the same kind of way. Sometimes you would get something that in an adult would cause them to be really hyperactive, but it calms a child down because the nervous system doesn't react in the same kind of way. The organs of the body react differently to a drug. Pregnancy affects the drug's effectiveness, and you have to be careful because what goes into the mother also goes into the baby. And in terms of age, elderly don't react to drugs the same as other people who are younger. So there's lots of interaction. Some drugs cause physical and emotional dependency, but not all. And some drugs cannot be tolerated because they have intense side effects. And some drugs you may be allergic to. And if you do have drug allergies, you need to watch because it's awfully easy to get more and more allergies. You may start off with 1 or 2 allergies, but then you may have 15 allergies by the time you're an adult. The body just seems to react in an allergic manner to what's put into it. Now, you have also the generic and brand name drugs. The generic drugs are cheaper. They have the same ingredients as a regular prescription has, but it has different filler material, it's processed different, and so it is cheaper. Now, for most people, the drug, if it's a generic, works just as well as the more expensive one, but not for all people. It depends upon how your body reacts to it. There are certain segments of society where they can't use generics because the generics are not as effective as the regular prescription. But for many people, the generics work just as well, and it is a lot cheaper, and usually doctors will allow you to have the cheaper one. Although I went to an eye doctor once, and he insisted that he would not give any patient a generic. For some reason, he didn't trust them, and he always demanded that the patient get the regular prescription. And he would write right on the prescription, no generics allowed. And sometimes the pharmacy didn't even carry anything except the generic because that's what most people were buying. So they'd have to scramble around and see if they could get the original, which would be, of course, 3 or 4 times more expensive. So the prescriptions will tell a pharmacist the drug, the amount of the drug, and the instruction in terms of how to use them, and that's all printed out on the prescription. And if you're familiar with years ago, the doctor had a prescription pad, and it was like about yay big, and they just wrote all that stuff down and handed it to you, and you took it to the pharmacist. Now, the prescriptions are 8.5 by 11, kind of grayish looking, and they have the information, but on the bottom there is an oval, and the oval is pink. And a pharmacist, all they have to do is check and put their hand or put a finger on the pink spot, and it will change color. And then when they lift their hand up, it reverts back to being pink. So they know the prescription is a real prescription. It's not something that anybody made up just to get drugs. It's the real thing. So you give them the real thing. And a lot of times what they do is just fax in the prescription. You don't even bring it in anymore. They fax it in, or they electronically have it in. And so you just go to the pharmacy and pick it up when it's ready, and you don't handle the prescription at all. But those prescriptions now are more complicated. They're full-size pages, 8.5 by 10. They have symbols on them and all of that. They're grayish, and then they have that pink spot. Anything to prevent people from getting drugs that they are not supposed to have. And so taking too much or taking too little of a drug can be very, very injurious. Drugs taken by mouth are processed in the liver, and then they are excreted through the kidneys. So there is a process that goes on in your system. If the kidneys can't eliminate what's supposed to be eliminated because you have a kidney problem, then you can have too much of a drug that's settling into tissues because the liver is not processing it, or the kidneys can't get rid of it. So there's that whole thing. It's just so complicated. So if the liver is damaged, it can't process the drug. If the kidneys are damaged, they can't necessarily get the excess out of the body, which they need to do. So we're kind of done. I may add some more things next session, but basically we're finished what I need to tell you about how the drugs are developed, what their schedules are, how they get into your system, what the research is, and how many years of research on a drug before they can even allow it in the market. All of this is expensive. And of course, drug companies will say they have to raise prices in order to afford the research on the drugs that they are doing. And I think partly that is true. And we just hope that it doesn't get so greedy that patients can't afford to buy the drugs that they're doing the research on. So it doesn't do any good to have wonderful drugs if patients can't buy them because they can't afford them. So at any rate, I'm going to close it here. And we may have a little more to do next time, but not a whole lot. So if not, then we'll be doing something else next time. So please join me next time.